We're here today to protest the proposed rule changes for midwives because they essentially tie midwives' hands behind their backs.
The most pressing concern that midwives have at the moment is that they want to remove our ability to carry and administer meds in an emergency situation.
But I've had all midwives for my 8 births, all natural, no problems, no complications, no drugs. I did have to have Pitocin after my 6th baby, so I'm very glad that she was able to have that because I don't know if I would be here for the rest of my kids.
Midwives should not be put in the position of being legal or safe. The legal requirements should be consistent with safe, modern practice of midwifery.
I've had 2 home births, wonderful home births. I would love to have my children do it again.
Is written into our rules is that there are certain medications that we're expected to use in an emergency situation, clearly written in our rules, as well as certain medications we're expected to administer for newborns. However, at the same time, what they're doing now is saying, well, yeah, we know that this is how it's been for 30 years, but clearly it's a felony. So now you have, midwifery has changed so significantly in the last 30 years with the professionalization of the profession. We now have a national agency that certifies us. It's the NACPM, which gives us our certification. And so to actually go back and take that away doesn't make any sense. So what we're asking is that if indeed that's the case and we want to honor our statute, we also don't want all of these women getting midwifery care by July 1st for their lives to be in danger. So what we want is the initiation of the proposed rules change to not take effect until we have the opportunity to go to legislature and try to change the statute.
It makes me want to leave the state.
No.
I don't want to live here. I don't want to have another child in Arizona. This is listening.
They're actually saying that women who refuse testing or refuse interventions, things like that, can no longer be attended by a midwife, which also then puts their health at risk.
So I'm very concerned about the women's right to refuse, which is the second half of women's right to give consent. Informed consent and informed refusal is part of healthcare, part of ethical healthcare, where you can say, yes, I agree with this test or this maneuver or this medication, or no, I don't. I don't think that we can have true informed consent without the possibility of informed refusal. That applies in hospital and in home and birth center.
No coerced consent! No coerced consent!
It's a public health issue because we already know that there's an increase in maternal mortality. We already know that women of color, particularly for those of us that actually do work, I do work in public health, that's a big concern for me because those women are dying 3 to 4 times more than white women.
That my midwife will have more restrictions and less freedom to help me in labor. And especially when I live in a rural area and the backup hospital has to be 25 miles away, that won't work right.
The Arizona Department of Health needs to do their job and provide safe rules and regulations for home birth midwifery.
It's just important that midwives be able to have what they need when they're going to do this to have it be safe.